So today I'm going to be treating frozen shoulder or non-specific anterior shoulder joint capsulitis. This treatment today will be to the anterior shoulder. There isn't actually a clinical protocol built into the Endolaser 120 for this treatment, so we're going to be using its manual operation. Press manual operation. It'll ask whether you want to do points per centimetre squared or milliwatts, so we're going to set it in points per centimetre squared. If you look here, you'll see points. We're using a cluster probe, so it will only go in multiples of 4. That's because within the cluster probe there are 4 laser diodes, so you go 4, 8, 12, 16, etc, etc. We're going to go one spot, so 4 points in this case. Come back, and now I have to set my joules per point. So I've got 4 points, and I'm aiming for about 12 joules in total. So I'm going to go 3 joules per point, and 3 times 4 is obviously 12 joules in the session. It's saying that we're going to give 400 milliwatts. That would be too high really for the anterior shoulder, so we're going to come down. I'm actually going to come down to 100 milliwatts, and you'll see now it's worked out the time at 30 seconds. It's going to take 30 seconds to give 12 joules across the 4 laser diodes at 100 milliwatts. We'll press OK, and we're ready to go. We'll see back at the patient. So here we're going to be treating the front of the shoulder for adhesive capsulitis, non-specific anterior capsulitis. I'm going to be using the cluster. It's fairly straightforward, just come straight onto the front of the shoulder where the inflammation would be, and we'll start the laser treatment. There's no need to move the laser. This would be very similar treatment to the supraspinatus tendonitis from the front of the shoulder. It's a treatment that's best performed in conjunction with exercises. It's a fairly quick treatment. Tends to be most effective when patients have got more than 50% of the movement. You'll see here I'm not moving the cluster. If you were using a single probe, obviously you'd have to do spots. You probably want to do 4 spots, to be honest. That's the end of the treatment. This is what makes the cluster so efficient, because there's 4 lasers within it. And that's the end of the treatment. Seen from the laser perspective, we start the treatment. You'll see the counter start to count down and the applied joules start to count up. Treatment of frozen shoulder, adhesive capsulitis, non-specific shoulder capsulitis is controversial in the literature. Some studies have suggested low levels of evidence, some moderate, some higher. Tends to work better if you add in exercise therapy at the same time. That's the end of the treatment there. I would think it depends largely on how bad the amount of limitation of motion is when you give the treatment. If the patient has got extraordinarily limited range of motion, then laser may not be the best option. If the patient has got more than 50% range of motion, then laser may well be a good option with some sort of mobilizations and exercise regime. I wouldn't expect the laser to cure an adhesive capsulitis or just a capsulitis that was limiting motion, but certainly it can be a good adjunct to the other treatments of mobilizations and home exercise program.